Hello everyone. Mode of ventilation differ in the way they initiate, maintain and terminate inspiration. In technical terms, trigger, target and cycle. In this lecture, we'll understand what target means in ventilation. Target is something what you sustain during the breathing. Different ventilation mode have different targets, for example, flow and pressures. As we discussed before, triggering phase is what starts the inspiration. Cycling phase is what ends the inspiration, and target is what you set to get the volume. And we learned that volume is not the target, but it's the end product. When you are breathing normally, you're generating some tidal volumes, and there are two ways to do it. Either you generate a negative intrapleural pressure or positive flow, which pushes the air. Ventilator does the same thing. And flow and pressure are related. Pressure generates flows, and flows will result in pressure gradient. This is a little difficult concept to understand, but I think once you go through the third phase, which is cycling, you will understand this term better. So target is how your breath is delivered during the inspiration, and it is the variable that you use to give the breath, and this variable is not exceeded. For example, if you set a flow at 40 liters per minute, that flow is going to generate a tidal volume. And if you set pressure, for example 20 centimeter of water pressure, that pressure is going to generate a tidal volume as well. Ventilator is not going to exceed these limits. That means if you set your flow at 40, the vent will not increase the flow more than 40 liters per minute. And if the pressure is 20, vent will not give you any more than 20 centimeter. And both of these will generate volume. So volume is the end product of this target, but it is not the target. So you can either set a pressure target or a flow target. And this target will continue till cycling phase starts. So if you set a pressure target, for example 20 centimeter of water, that 20 centimeter of water will persist till the cycling phase begins. The same thing happens with the flow rate. The flow rate, however, comes in different shapes. You can either have a square waveform or a descending waveform. There have been other waveforms that have been studied, like ascending and sinusoidal, but these have not found to be any benefit, so they are no longer used. As you remember, when you breathe, you generate a steady negative pressure in your pleura and you generate a descending flow pattern. So a pressure target or a descending flow target matches more to what a normal breath looks like, so these are more comfortable. Volume assist control uses flow targets. This flow will generate a tidal volume at a steady level depending on the level of flow. This will also create pressure in the airway, which will depend upon the resistance and compliance of the airways. Pressure is the target in the pressure control modes. This pressure is going to generate a flow waveform, which will depend upon the pressure gradient between the pressure given by the ventilator and the alveolar pressures at that time. And this pressure gradient will depend upon the resistance and compliance of the airways. And this will determine your tidal volumes. Let's look at volume assist control. Pressure will depend upon the resistance and compliance of the airways, and you'll get the tidal volume at a steady level depending on the level of flow. So if your flow is higher, your tidal volumes are going to be higher, and you're going to generate more pressure in your airways. If there is an obstruction or resistance in the airways, you still will generate the same tidal volume. However, your pressure in the airways will go up. Similarly, if your compliance worsens, you will still get the same tidal volumes, but your pressure will go up. This is one of the advantages of volume assist control, that you will get the set volumes, what you put on the ventilator. And if there's a problem with worsening resistance or compliance, your peak pressure alarms are going to go up, and you can use these waveforms to analyze the resistance or compliance problem in the circuit. For more details, see my lecture on peak and plateau pressures. Pressure is the target in pressure assist control. So here the flow will depend upon the pressure gradient between the pressure given by the ventilator and the alveolar pressure. As these alveoli fill up with air, the pressure is going to increase, so the gradient is going to decrease. So you can see that the flow pattern, you will see a peak followed by a slope. And this will depend upon the resistance and compliance of the airways and the alveoli. And this is what will govern the tidal volume your patient gets. If you have increased resistance, your flow will decrease and so will the slope of the flow, and your tidal volumes will go down. If your compliance is worsening, your flow will decrease, however the slope of the flow will remain the same, and as these alveoli fill up quickly but generate higher pressure at lower volumes, your tidal volumes are going to drop. So this is one of the problems with pressure assist control, that whenever you have change in resistance or compliance, your volumes are going to change. So make sure that you set the low tidal volume alarms appropriately to avoid getting into trouble. You can certainly analyze the resistive and compliance problem by analyzing the flow waveforms and looking at the peak and slope. However, this is more difficult. The pressure assist control modes are much more comfortable as they allow the patient to generate their own flow. Volume assist control has two waveforms that we use commonly as our target, a square waveform and a descending waveform. In square waveform, you get a volume at a steady level depending on the level of the flow, and in descending waveform, you'll get the volume at a slowly decreasing level depending on the level of the flow and slope of the flow. As the time progresses during inspiration, you can see the flow coming down and change in the volume slowly goes down. And once flow reaches zero, you do not get any more tidal volumes. One of the difference that you can already see between square waveform and descending waveform is square waveform will generate a peak pressure, while descending waveform will not give you a peak pressure. However, descending waveform is more comfortable for your patients. Other thing that you can see is square waveform requires shorter eye time to achieve the same tidal volume, while a descending waveform will require longer eye time to achieve the same tidal volume. This is useful in patients with COPDs or obstructive disease in which you have to manipulate the E time. You can use square waveform in this patient to give you some extra expiratory time. So you can choose between these two waveforms depending on your patient's need. Descending waveforms, since they're more comfortable, are more commonly used. However, when you are troubleshooting the ventilator, changing to a square waveform and figuring out peak and plateau pressures helps. The pressure assist control and pressure support modes both have pressure targets, and just like the pressure assist control, the flows in pressure support will depend upon the pressure gradient between the pressure given by the ventilator and alveolar pressures, and that pressure gradient will depend upon resistance and compliance, and that will determine the tidal volume. So the target in both the pressure assist control, and pressure supports are the same. In summary, target is the parameter that you want to use to give the breath, and your ventilator will not exceed this value of this variable. Target is of two types, flow target and pressure target. Volume assist control uses flow target. Pressure assist control and pressure support uses pressure targets. Understand that volume is not the final target, it's the end product of your target. Volume will depend upon both the target that you set and the type of cycling that your ventilator does. We'll talk about cycling in our next lecture. Thank you.